I was born in Lafayette, Louisiana, and raised in Louisiana. My family moved to Australia for a couple years. When I was young, I started school in Australia, and then we moved back to New Orleans, and I finished high school in New Orleans and went to college at LSU in Baton Rouge. Currently, much of my free time revolves around a 13-year-old son and a 12-year-old daughter, and we have fostered puppies. At one point we had 7 puppies at our house, but I like to play golf when I can. Cardiology drew me because it has a combination of stuff I like doing. You get to see the patient, interact with the patient, examine the patient, and then it has procedures, which I liked. I did cardiac catheterization for many, many years. And you have a longitudinal relationship with the patient. So many patients I care for now, after being here 30 years, I cared for when they were babies. So you have a long-term relationship, and I enjoy that. Pediatric cardiology is the most common congenital problem. It affects about 1 out of every 100 kids born. And many times nowadays we can identify a problem before the baby's born and plan for their care after birth. We now have our patients surviving so long that there's now more adults with congenital heart disease than there are children with congenital heart disease in the United States. So all that is a big success given where we were 30 years ago. From fetal life to newborns to young adults to older adults, we cover the spectrum, and we have a collegial group of people. We have excellent heart surgeons that we work with. We have excellent cardiac anesthesia people that help provide anesthesia for procedures that we do. So it's very much a team sport. Part of what has helped me grow as a healthcare provider is being in a program where we are continuing to advance the field and staying on the cutting edge, but also being able to take care of patients from birth to adulthood is something that you appreciate the progress that patients make. You may take care of a kid in the intensive care unit one day who looks deathly ill, and you see them in clinic a month later and they're doing great and have more energy than they had before. And so those sorts of opportunities to see improvement are really what drives you to keep doing what you do.